Welcome to another episode of the News Roundup. Today we're going to be talking about the CDC, which is greenlighting Pfizer's BioNTech booster dose for COVID-19 for children ages 5 to 11. We're going to discuss the CDC's viewpoint on the matter, as well as address some concerns raised by Dr. David Weissman in written comments to the CDC about limited data and withheld evidence he alleges that perhaps should have been considered first. And so, from Trial Site News, I am Adrian, and our episode is starting right now. So, in an article posted on Trial Site News back on May 20th, Dr. David Weissman wrote an opinion piece on the CDC greenlighting the Pfizer's BioNTech mRNA booster dose for children aged 5 to 11. The Centers for Disease Control and Prevention, or the CDC, convened a meeting of their Advisory Committee on Immunization Practices, otherwise known as the ACIP, after an Emergency Use Authorization amendment was issued by the U.S. Food and Drug Administration, otherwise known as the FDA, back on May 17th. This amendment expands the eligibility for the Pfizer's BioNTech COVID-19 vaccine booster dose for children ages 5 to 11 years, at least 5 months after completion of a primary series. Responding to the policy question posed by the CDC and, quote, based on the balance of benefits and risks, the ACIP voted in favor of the following interim recommendation, saying that a single Pfizer-BioNTech COVID-19 vaccine booster dose is recommended for persons ages 5 to 11 years, at least 5 months after the primary series, under the FDA's Emergency Use Authorization. In the Dr. David Weissman opinion piece, he also noted that Pfizer reported no new safety concerns. For the evaluation of safety, 401 children were followed for 1 month after a booster dose was given at least 5 months, ranging between 5 to 9 months after completing a 2-dose primary series. The sponsor reported that this analysis did not raise any new safety concerns. They reported no new cases of anaphylaxis, myocarditis, pericarditis, Bell's palsy, or facial paralysis, or appendicitis were observed. Effectiveness was based on immunogenicity studies. For effectiveness, antibody responses, immunogenicity, were evaluated in 67 study participants who received a booster dose 7 to 9 months after completing the primary series. The change in neutralizing antibody against the wild-type Wuhan strain levels from before dosing to 1 month after dosing for the third dose was compared with the change occurring before the first dose and 1 month after the second dose of the primary series. Another 30 subjects contributed to another assay against the B1.1.529 Omicron strain. Now, following this meeting, Dr. David Weissman submitted written comments to the CDC. In it, he noted that key data was not shared with the ACIP to allow their assessment of the risks and benefits of the booster dose for the 5 to 11-year-old children age range. Here is an example of some of the concerns Dr. Weissman raised to the CDC. First, he said that Pfizer's safety evaluation relied on a small number of children, 401, followed for only a short time, 1 month. The original primary series evaluation involved approximately 4,600 children, followed for up to 3.3 months. Next, he pointed out that Pfizer committed to a study on subclinical myocarditis and troponin levels, and that this has not yet been produced. He also noted that no clinical efficacy data was provided. Effectiveness was judged based on immunobridging data. In numerous public meetings since September 2021, FDA and CDC officials have stated unequivocally that there is no immune correlate of protection. In other words, effectiveness is being judged using a surrogate endpoint that has not been validated. Next, he talked about the CDC showing its own data describing the waning of primary series response in various pediatric populations to ineffective levels well before the 5-month period set for the booster interval by this Emergency Use Authorization. He also pointed out that the CDC suggested that protection in older populations by boosters against severe outcomes would be replicated in children. However, data presented by the Israeli Ministry of Health at the April 6th VRB PAC meeting shows that even this effect wanes were not provided to the committee. Dr. Weissman also pointed out that the CDC stated that the rates of myocarditis following boosters in older children are lower after the second dose. Their published rate of 11.4 million in 12 to 17-year-old males is lower than the rates of 17.2 per million in the 12 to 15-year range and 23.2 per million in the 16 to 17-year range presented at the ACIP meeting on April 20th of 2022. These in turn are far lower than the alarmingly high rates of about 90 per million presented by the Israeli Ministry of Health at the April 6th VRB PAC meeting and not provided at all to the ACIP. The CDC have recognized that MIS-C may occur in unvaccinated children, but were unclear whether, as suggested by ACIP's Dr. Long, that myocarditis and/or MIS-C may be partly accounted for by vaccination following COVID-19 infection. A recent NIH-funded study in adults found that people with prior COVID-19 had greater odds of adverse effects and more severe adverse effects after COVID-19 vaccination. Dr. Weissman also alleges that the CDC is continuing to ignore adverse effects other than myocarditis. A recent paper, for example, from the National Institutes of Health has acknowledged that neurological events may occur after COVID-19 vaccination in rare cases. Now, for a full discussion of Dr. Weissman's viewpoints on this and his commentary on the subject, we're going to link to the article in the description below. So, now that we've talked about some of the concerns raised by Dr. Weissman, let's take a quick overview of where the CDC and the FDA stand currently on children ages 5 to 11 getting the booster shot of the COVID-19 vaccine. Well, currently only Pfizer's BioNTech vaccine shot is authorized or approved for the age group of 5 to 17. The CDC's official stance on safety for the Pfizer booster in children is that clinical trials and ongoing safety monitoring show that COVID-19 vaccination is safe for children and teens. They do address the potential for serious health events after COVID-19 vaccination, but stress that these are rare, and the CDC makes mention of rare cases of myocarditis and pericarditis that have been reported after children and teens got the Pfizer's BioNTech COVID-19 vaccine. And that the new studies have shown that rare risk of myocarditis and pericarditis associated with mRNA COVID-19 vaccination from Pfizer's BioNTech and Moderna occurs mostly among males between the ages of 12 and 39 years of age, and suggest that the risk of this occurring may be further reduced with a longer time between the first and second dose. Meanwhile, the World Health Organization recommends that vaccinated individuals should be instructed to seek immediate medical attention if they develop symptoms indicative of myocarditis or pericarditis, such as new onset and persisting chest pain, shortness of breath, or palpitations following vaccination. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining me on the show today. From Trial Site News, I am Adrian, and I will see you all next time.